Tuberculosis is the topic for this video, and tuberculosis is actually a very common worldwide infection. And let's get started. Basically, it is an infection of the lung, and it is very commonly associated with hemoptysis, which is coughing up blood. And the treatment actually involves multi-drugs, as many as 4 for a long period of time, 6 to 12 months. And there's a lot of screening tests done worldwide, and we'll talk about that as well. So quite a bit to cover. So why does this happen? What is the cause or etiology? Well, tuberculosis is basically caused by a organism known as Mycobacterium tuberculosis. That's the name of the organism. And human beings are the main reservoir for this organism. And it's actually spread, it's an airborne illness, meaning it's spread by air, and a person will get it by an inhalation of these particles that contain this Mycobacterium tuberculosis. Now, how do these particles get into the air? Well, they get into the air when somebody who has TB, TB is my short form for tuberculosis, or not just my short form, but it is the short form. When a person with TB coughs or has any kind of forced expiration, the Mycobacterium particles get into the air, and when those are inhaled by somebody else, they can be infected with this disease. So, really quickly on epidemiology, 15 million people at any given time worldwide have active tuberculosis. So it's actually very prevalent, and as much as 1/3 of the world, 1/3 of the world's population is infected without active disease. So the infection actually goes through a couple stages. You have the primary infection, and then you have active disease. Now, when somebody gets the primary infection, it basically typically does not result in infection, but it can spread to other parts of the body, and not just the lungs. It can spread to the bones. It can also spread to the meninges. Just as an aside, TB of the spine is known as Pott's disease. Pott's disease, and that's a commonly tested exam item. Just wanted to mention that. So, a person can be infected without having the active disease. Now, if the patient does have the active disease, then definitely this will take on a whole new category in terms of symptoms and signs, and that's when you get this symptoms of tuberculosis. So, what are the symptoms of tuberculosis? Well, there's some pretty vague ones. Individually, each of these symptoms are not really diagnostic because they're so common in many other medical conditions. But the key one, in my opinion, is really this one, because that kind of anytime you have blood in anything, whether it's coughing up blood or vomiting blood or urinating blood or blood in your stool, blood is always a pretty serious sign. Initially, the cough will be productive, probably yellow or green sputum, but then it will lead to hemoptysis. Now, another thing, of course, is if you have a risk of exposure, if you've been exposed to someone who had TB, that's obviously a pretty important fact. Another thing that's very concerning is night sweats. And these night sweats are pretty impressive. They're actually known as drenching night sweats, where you wake up in the middle of the night just soaked in sweat. So these are some of the symptoms. I'll put in fever in there as well, even though fever can happen in a long list of things. It can happen, of course, in tuberculosis as well. So how do you diagnose it? If somebody does have these symptoms, and perhaps they even told you that, yes, I did have exposure to somebody who had tuberculosis, then how would you diagnose this? Well, the main first imaging test is, of course, a chest x-ray. And then after that, you would test the sputum. And then involved in the testing is a skin test. It's also known as a PPD, purified protein derivative is what this stands for. I'll talk a little bit about that. So let's talk about these diagnostic tests. Well, the chest x-ray basically is looking for the infiltrate, and it's a very characteristic aspect of active TB, and the infiltrate will definitely suggest that there is active TB. The sputum is tested with a culture, and this is probably the most important test, and that is you have to examine the sputum and check for something called acid-fast bacilli. And this is, without a doubt, the most important test in tuberculosis, most specific test. And the acid-fast bacilli, or the presence of it, is a pretty key diagnostic factor in this disease. The skin test is rather interesting. Many of you probably have even had this already, where you place a small 1 ml amount of solution into the patient's arm. Let's just say this is and this area will eventually form a wheal, a localized skin reaction, and the diameter of that wheal is measured. And the diameter indicates whether or not the patient has tuberculosis. It's known as a positive PPD, or positive reaction. So how big does the diameter have to be? Well, there's 3 categories. There's people with no risk factors, there's people with some risk factors, and there's people with high risk factors. If someone has no risk factors, just the general population, the PPD, or the diameter of that wheal, is the diameter of the induration, or the localized skin reaction to the injection, has to be greater than 15 millimeters. If the patient has some risk factors, for example, they're a recent immigrant from a high prevalent area, or they live in a population that has close proximity to people who might be infected, like prison or homeless shelter, then the PPD should be greater than 10. And if the person has high risk factors, in particular people who are HIV positive, the PPD needs to be greater than 5. So these diameter readings are what's known as a positive reaction to the PPD. TB is usually curative. But about 10% of the cases are fatal, if the proper treatment isn't initiated. So what is the treatment? Well, the treatment of tuberculosis involves multi-line. There's 4 medications in particular. There's isoniazid, there's rifampin, there's ethambutol, and there's pyrazinamide. On licensing exams, they actually test the side effects of these more than they actually test the actual drug, I've noticed. So, let's talk a little bit about each of these. Isoniazid is the mainstay of tuberculosis treatment. It's also given for people who have a latent TB, meaning they don't have active tuberculosis yet. So the side effects that they test on the licensing exam, the way I remember it, isoniazid is abbreviated INH. Now, the way I remember it is that INH, you can kind of remember it as injures neurons and hepatocytes. And we're talking, of course, about the side effects. So what does that actually mean? Well, it injures hepatocytes. What we mean by that is one of the side effects of INH is that it can cause hepatitis. And it injures neurons. What you mean by that is that it can cause peripheral neuropathy. And the reason is because it can cause a deficiency of vitamin B6. And vitamin B6 is also known as pyridoxine. So oftentimes when INH is given, it's given with vitamin B6 to prevent that side effect. Okay, now rifampin, another tuberculosis medication. So what's the side effect that they test on the licensing exams? Well, this one is an easy one to remember. It causes orange urine, orange body secretions. That's just one of the main side effects. Ethambutol, very commonly tested side effect is that it causes optic neuritis. The patient will have an inability to distinguish between colors such as blue and green. And pyrazinamide is another bactericidal drug used in the treatment of tuberculosis. I want to talk about screening. Screening is important. When someone has close contact with a person who had active TB, that person should be tested, or screened rather. And you do it with the PPD skin test. And if the person's PPD is positive, then they should have a chest x-ray. And also, of course, they should have their sputum tested, sputum culture. And then if the person is indeed have active TB after you've done these tests, then the treatment will of course involve those 4 medications, multi-drug treatment. But sometimes a person can have latent tuberculosis and not have active disease. In fact, many people have that. So what do you do then? Well, the treatment of latent tuberculosis is generally consists of isoniazid, that medication I mentioned earlier, for about 9 to 12 months. And then finally, one last point is the prevention of TB, and it's a vaccine that many of you have probably even gotten. It's called the BCG vaccine, and it's currently given to over 80% of the world's children. So it's definitely very widespread. I finish up with a few clinical vignettes. You care for a family that consists of a 43-year-old husband, 42-year-old wife, 15-year-old daughter, and a 12-year-old son. Each family member is healthy. The 77-year-old maternal grandmother lived with the family until 4 weeks ago when she died suddenly after a prolonged respiratory illness. Autopsy revealed that she had active pulmonary tuberculosis at the time of her death. The organisms tested sensitive to all commonly used anti-TB drugs. Following up on the grandmother's illness, the most appropriate first step in managing this family is to... Now, this entire family has been exposed to the grandmother, obviously, who had active TB. So, as close contacts, they are at risk for transmission of TB. So the appropriate screening test, as we mentioned earlier, is the skin test, which is the PPD, which is right here. Complete workup, next question. Complete workup of each family member reveals no evidence of tuberculosis. The most appropriate next step is to... Now, a negative PPD, which is what happened, indicates that there's no TB, there's no latent TB, and there's no active TB. So therefore, there's no indication for any treatment. So medications. And then finally, the father mentions that his mother-in-law spent many hours with a nephew in the weeks prior to her death. This nephew is 26 years old, has lymphoma, and recently completed a course of chemo. You agree to see the nephew. As part of a thorough exam, you place a PPD. The PPD test is positive. Then complete evaluation of the nephew reveals no evidence of active tuberculosis. The most appropriate pharmacotherapy is... Well, this question indicates that this 26-year-old nephew has a positive PPD, but he does not have any active TB. So that clearly shows that he doesn't need the multi-line drug, all this stuff that they're talking about. But because he does have latent TB, he will need isoniazid, also known as INH, for about 9 to 12 months. So the answer to this question is A.